Hello, Senator Rubio. My name is Soraya Vibar, and I am a nurse advocate. Thank you again for taking the time to meet with me today as I plan to discuss with you an important matter relating to public health.
Welcome, Soraya. Yes, my staff had informed me about our meeting today. Let's start with you telling me a little bit about yourself. I would like to get to know more about the organization you represent as well as your background in healthcare.
Yes, of course. I have been a registered nurse specializing in surgical oncology for 7 years, where I provide direct care to oncology patients in both the preoperative and postoperative setting. I am also an active member of the Oncology Nursing Society, or ONS. As a nurse advocate and representative of the ONS, my mission is to collaborate with state representatives like yourself to help support our advocacy on behalf of patients and the profession to ensure respect and recognition, access to education, and safe working environments. Our organization also advocates for public health policy, something I know we share an interest in.
You are quite right. As a member of the Senate Committee on Health, we are often referred bills relating to public health. Working in oncology seems to be quite challenging. I'm interested to know about your experiences working in this specialty as a healthcare provider. What are some of the issues your profession is facing right now?
As a surgical oncology nurse that has helped prep patients for surgery with a DNR code status, I have personally encountered the complex difficulties associated with such pre-existing DNR orders. There exists this universal challenge among healthcare providers of understanding how to properly manage the care of such patients in surgery while ensuring the patient's advance directive is respected. Many of these surgeries I have seen are performed with the purpose of providing these patients who have a terminal illness with a palliative alternative. Some common examples include a tracheostomy, a central venous access placement for pain management, or release of a bowel obstruction. However, caring for this special population in the perioperative setting is a topic that is not usually covered in the formal training of healthcare professionals, which is the reason why I am seeking your support.
This does seem to be quite the delicate issue. Please tell me, what is the significance of bringing up such a matter to a government representative?
As a nurse advocate working alongside my professional organization, I am committed to advancing oncology nursing to deliver quality and equitable care to patients with cancer. This includes the surgical and palliative care of patients with pre-existing DNR orders. Up to 15% of patients undergoing surgical procedures present with an advance directive that includes a DNR order. However, there is a misconception that such orders must be suspended in the perioperative period. Patients also may face discrimination or denial of surgical treatment based on their resuscitation preferences. With a significant number of patients with DNR orders agreeing to have surgery and other procedures, healthcare professionals and government representatives must both acknowledge the need for more academic preparation in palliative care. Our collaboration is essential so that we can enhance the quality of care for these patients.
With your background and experience in oncology and palliative care, what proposed solutions or recommendations do you have for the Senate to help address this issue and initiate the development of the academic preparation you have suggested?
The key recommendation I offer to help bridge the educational gap that exists in palliative care is I ask for your support to help pass the Palliative Care and Hospice Education and Training Act, or S2243. This bill requires the Department of Health and Human Services to take a series of actions to improve the training of healthcare professionals in palliative care and establish traineeships for individuals preparing for advanced education nursing degrees, social work degrees, or advanced degrees in physician assistant studies in palliative care. Additionally, the HHS may provide support to medical schools, teaching hospitals like the one I work at, and graduate medical education programs for training physicians who plan to teach palliative medicine. If passed, this bill will create and promote education programs to expand the palliative care professional workforce, support research on palliative care interventions and delivery, and implement a public awareness campaign to educate the public on palliative care. By requiring institutions to provide mandatory training and education related to palliative care and advanced directive care planning, we can expect better patient outcomes. With your help as an active member of the Senate Committee on Health, together we can shed light on the importance of this issue and support the process of moving this bill forward.
As I had mentioned before, I serve as a member on the Senate Committee on Health, and we review legislation such as this that is aimed at improving the health and well-being of the population. Our committee addresses a wide range of public health issues, including access to healthcare services and health disparities, which I understand is also the focus of your organization. That being said, what can I do to assist my support of this bill?
Together with your advocacy work in healthcare and the power of media platforms, we can bring attention to this crucial issue and advance this bill for consideration by the full Senate. Therefore, I am asking for your support to write an op-ed that can be published in your district's local newspapers to highlight this issue and the need for this bill to bridge the gap in palliative care. This is an excellent opportunity to engage with our communities in the efforts to provide inclusive palliative care to all. Newspapers have immense potential for generating health awareness and can be instrumental in implementing the public awareness campaign that the bill proposes.
Newspapers are a great way to get adequate coverage of this issue that is affecting both healthcare providers and patients. I agree we must extensively train our healthcare professionals so that they are prepared to appropriately care for these unique perioperative patients. Let's move forward, and we'll begin by writing this op-ed in support of this bill and to create awareness of the need for equitable palliative care.
I look forward to collaborating with you in these efforts to enhance patient care for our communities. For your reference, I have prepared a one-page policy brief that summarizes our organization's purpose, as well as the bill and its provisions. Should you have any questions, please feel free to contact me, as my information can be found on the page. Thank you again for your time, Senator Rubio, and your continued endeavors in improving the care of our patients.
You're very welcome, Soraya. I also look forward to our collaboration, and I appreciate your commitment to your professional growth for the well-being of your patients.